Hello, lovely. How are you? Good. Thank you for coming in today. It's a brave step in the right direction. Okay. You got nothing to worry about. We'll go at your pace. Okay. Good. Get yourself comfortable. Okay. You don't need to worry. Whilst you get yourself comfortable, I'm just going to pop down your name. Okay. Okay. So, how are you feeling? I get that. Yeah, it's been a very difficult year for everybody, and everyone deals with things differently. Okay. So, your main concern is your weight gain. Okay. Has this been just through lockdown, or has it always been an issue? Okay. Yeah, so you started comfort eating, which turned into binge eating. Okay. Yeah. Okay. And do you know what started you off with comfort eating? Yeah, it's boredom. Lonely. Yes. Yeah, I needed to pick me up. Any other reason, do you think? Has it made you feel better? Yeah. And you felt like it's not really an issue, what's the point? Things like that. I get that. Okay. Do you know what your weight was before lockdown? Okay. And do you know what you weigh at the moment? Okay. Well, if I can get you just to pop on the scales for me, if you don't mind. Thank you. Okay, that's perfect. Come sit back down. Okay, so there is a fair increase in weight, okay, and I can see that really bothers you. And have you tried to do anything about the gain? I know it's been difficult with gyms closed and things like that, and working from home and being isolated and things. very hard not going out much. Okay. Right. So you just got a taste for the food, I suppose, the junk, chocolate, crisps, cake, cream cakes, donuts. Yeah. And then it just became a habit. Yeah. And then it was just picking all the time, just scoffing a whole pack of biscuits and cookies. Yeah. Sweets. I get that. Okay. So, when the binging started, do you know why it changed into what was comfort eating, a habit, into more excessive eating? Okay. I guess, yeah. So just over time it just kind of happened and you didn't really realise it. Yeah. And do you think it contributed to how you were feeling? So did it help you feel better about yourself, or did it pick your mood up? Did you just feel better overall when you were eating sweets, the crisps and things? Yeah, feeling better. Releasing those endorphins. Yeah. And then you just wanted more, and then your stomach gets a bit bigger, can handle more food, the more you want it. Yeah. Okay. So when you say you binge, how much and when? Just day to day. Would that be at one time? Okay. And what kind of times usually? Okay. So evening time. So when you get down in your comfies, pyjamas, relaxing, watching TV, movie and things like that, do you want to pick? We all like a treat, don't we, when we, watch movies and things, but was it more than that? So it would be like a full bag of sweets, fair size of crisps, slab of chocolate, lots of crispy creme donuts. They are lovely though, in moderation. Okay, so it just become excessive. Okay, yeah. And is it just the junk that you are binging on? Yeah, okay. What were you having for normal meals? What are you having? Okay, so not too bad for normal meals then, which is good. And what kind of portion sizes are you having? So not too bad, but maybe a little bit bigger. Yeah, as you've come through the lockdown, which is understandable if you're eating and picking more. Okay. It's very difficult when, we can't get a lot of exercise and we're all trapped, isolated and things like that, Have you been doing any exercise at home at all? Yeah, so no motivation. It's very difficult, I suppose, in general, but when you're at home, it's like, what do you do? Do I go out and spend a fortune on certain gym equipment or things like that, and then when you've got them, what do you do? Yeah. Okay. Do you go out walking at all? Okay. It's not much. So would you say you're not very active? Have you been feeling depressed at all? Low mood? Okay. Do you think that the binging has been triggered because of your mood? It's a possibility. Some people binge and then that can make their mood low. Vice versa. Okay. So you feel like your mood was the issue first, but you didn't really notice it, you didn't understand it. Yeah, didn't really pay much attention, you were just, passing time by. Are you working at the moment? Okay. Do you have a partner, children? Okay. Okay. I can see it's really upsetting you. I know. It's alright. Let it out. Do you feel the binge eating is like an addiction? Do you feel hungry and then you eat? You just get these intense cravings and you just give in? Are you bored and then just eating because you're bored? Okay. So, say sometimes, because you're hungry, and you'll just choose to eat the junk. Okay. And other times, because you're bored. Okay. Anything else? Okay. If you think of anything, let me know. So, how do you feel in yourself about how you look? Okay. So, you'd say you're angry. Why? So, you're angry at yourself for letting things get this far. Alright. We need to let go of that anger. Alright. That's not going to help. You can't punish yourself for any of this. Okay? Alright. And you say you don't like what you see. Okay. What does your partner think? Okay. So it's not really come up. Okay. do you think the topic has been avoided, or have you particularly noticed? Because time passes us by and we're always in the company of each other, and you know. Okay. So, are you constantly thinking about your weight and the way you look? Okay, so you're worried that your partner will no longer find you attractive? Okay. How's your sex life? Has that been suffering? Okay. When did things really become an issue for you? As in, when did you start thinking, my weight, I look fat, or I look disgusting, or I don't feel happy or comfortable? How long was that? Okay, so you go up a dress size, and that's when you start thinking, then looking at yourself in the mirror. I get that, yeah. So it's more of a recent thing. Okay. I'm sure your partner loves you. Okay. Have you got any issues in the relationship? Okay, so no issues, but you're pushing them away, is that right? Okay, because of the way you feel and look. Okay. I know it's easier said than done, but they love you for you, clearly find you attractive, and from what you said, it doesn't seem like a problem to them. But we've all got to feel happy within ourselves, okay? And it's good to feel proud of who you are and how you look. Okay, just embrace it. However, if it's becoming an issue physically, it's affecting your health and things like that, that's when we need to start looking at doing something about it. Okay, so I'm going to ask you a question. The question is, if you could eat anything you like and you weren't going to put weight on, would you still eat that? Okay, knowing it does put weight on, does that want you to stop eating it? Or at least binging on it? Yeah, but you can't control it. Okay, so the willpower is kind of weak. So no motivation. Yeah. So you start to, you feel like you're going to do this, then you don't stick to it. Okay, don't pressure yourself though. I find a lot of people, they pressure themselves and it has the opposite effect, They start craving everything all the time and eating more, putting more weight on, and really going backwards, and we don't want that. No, we don't. Okay. So is the binge eating becoming a problem? As in, is it taking over a lot of your life? So I feel like that's a coping mechanism. Okay. Have you ever suffered with an eating disorder before? Bulimia, anorexia, or binge eating before? Okay. And when was that? So when you were a teenager then, so anorexia. Okay. I've had several patients that have had bulimia or anorexia, and in their later life they have the opposite effect. Not necessarily binge eating, but you know, not really caring, and they put on more weight and quite quickly. Yeah. So that could be a part of it. It seems to be a thing sometimes that we can see. It's a trend, as in people who've had an eating disorder can have an eating disorder in another way. Okay, I feel like it is becoming a little of an addiction for you to eat that amount of food, and you're going in a vicious circle. Yeah, and then it's affecting your mood and you're feeling worse about yourself, and I really think it's, you know, affecting you mentally. I really do. So, have you been having any anxiety? Okay. And what over, please? Going out, getting ill. Seeing people. So going back to normal as well. Yeah. Being trapped. Okay. Alright. I do think you are experiencing depression. Okay. And I think that is contributing to the eating disorder. And the addiction. Okay. Yeah. Sometimes it takes somebody to kind of point it out to you. Alright. It's alright. It's okay. It's alright, lovely. I know. You do really, really well, though. Alright. I know. Yeah. Like I said, it's a brave step coming here, you know. I mean, I can help you with things, alright? I don't want you to go on fad diets, okay, and yo-yoing, because that will end up worse. You'll end up putting it all back on quickly and, you know, putting on more weight. You know, and then I don't want you starving yourself and going back down the route of anorexia again. Yeah. And it's not good for you. And then, you know, I don't want you keeping yourself isolated when we can go out and about, you know. But I want you to feel confident and good in yourself. Yeah. And now the gyms are back open again. I mean, have you got any thoughts about going to the gym? You know, just a bit of exercise, bit of fitness, bit of motivation, help pick up your mood a little bit. Yeah, I mean, don't be scared. You know, you can go in daytimes and when it's not busy, you know, and get yourself a personal trainer and things like that, and they'll really help you get you a program, and in the personal training sessions they'll really, you know, push you and things. Okay, and then we could possibly talk about, I don't like to call it a diet, okay, so a food plan. Okay, not diet. So we're going to start, I think, just by cutting down. Okay, just cutting down. That's all. No meals, your normal meals, portion size. Drop the portions. Okay, you know, try to eat a little bit more, you know, fresh cooked food. I know you do quite well, but you know, and just cut out the Coke. Alright, I think the fizzy pop isn't good, and that is high in sugar, and I think that's, you know, the starting point. So I think, okay, portion control. So just smaller portions, alright? See how you go. And more fresh food. Okay? Good. Less takeaways. But can we say one a week? Yeah? How about a Friday? Have that as like a treat night. Yeah? So Friday, treat night. Or some call it their cheat day. Okay, so have your nice takeaway, you know, treat yourself some chocolate and crisps and things and sweets, but try and eat just a little bit less. How about share the packets instead? So the packet of crisps, share some with your partner instead, split it. Yeah? Same with the sweets and things like that. Try, instead of having 2 donuts, just have the 1 donut. Yeah? All I'm asking is to try. Yeah? It might not be easy. I'm just giving you ideas. Okay? We need to get into the motivation and encouragement. You know, you've got to want to do it as well. Okay? And we do have to help ourselves. But I do want to do something about your depression and anxiety. Okay, I think that is a big contributing factor here. If we don't work on that, it's going to be very hard for you to focus, concentrate, and stick to a bit healthier eating, less binging, and working out and things like that. Okay, so portion control, more fresh food, less takeaway, Friday night treat. Okay. Try to cut down how many you have. Okay. Drink water throughout the day. Okay, so fill yourself one of these. Okay, one of these bottles, and here you'll see how much you should be drinking at what time. So 8 a.m. till 2 p.m. You know, so you've got 8, 9, 10. Got halfway there. Don't stop now. You've made it. Time to refill. They are fantastic for motivation. You know, if you don't like tap water, get yourself some bottled water. You know, put it in the fridge and then fill up one of those. Yeah? The fluid intake really help hydrate you. Okay, it's good for you. Yeah. And I think that would be really good to start. So more water. Instead of having a can of Coke, go for a glass of water, a bottle of water. I know that doesn't sound very appetizing. Yeah, and then on your cheat night, have a can of Coke or something like that. Or have an alternative. So if you need a fizzy pop, how about a Sprite, Tango, something like that. That aren't as bad for you, but they are still bad. Maybe a zero or a diet drink or something like that, you know. Yeah, do you drink alcohol at all? How much? Okay, it's not too much. That's good. It's not always. Do you smoke? Okay. Are you on any medication at the moment? Okay, and what's that for? Okay. Is everything okay on that? Good. Is there any health issues that I need to be made aware of? Good. Okay. Any family history of eating disorders, addiction? Okay. Any family history of depression, anxiety issues? Okay. Have you ever suffered with any mental health issues before? Okay. Okay. Can I have a look at your mental health questionnaire? Okay. I'm just going to go through this, alright? You just take it easy. Okay. Looking at that and what we've spoken about, I would say you're suffering with major depression. Okay. And some anxiety. Okay, I'm thinking social anxiety disorder. Okay. And I think that has triggered social anxiety because of lockdown and things like that. Unfortunately, we're going to have a lot of that. Yeah. Okay. And I would like to put you on some medication. Okay. Something that, doesn't really have any side effects. And we don't want something that's going to put on weight. Okay. And I know a lot of mental health pills can sometimes have the other way, but we can work around it and see what happens. Okay. How's your sleep? Okay, so you get a bit hungry in the night. Okay. Thirsty. How's your waterworks and bowels? Okay. Okay. All right. Okay, so we need to work on the major depression and the anxiety. Okay, so I'm going to give you some medication for that. I would like you to talk to the wellbeing clinic. Okay. Just about your mood, anxiety and things like that, okay? Yeah. I think it might be good for you to see a nutritionist, okay? Not a dietitian. Okay. And I would like you to see a personal trainer. I can get you one of those. Okay. In the NHS, that's fine. And they'll be able to sort you out with a gym membership if you wish. I would like you to meet up with a nutritionist, a personal trainer. Okay. I'd like you to sit down. They will do measurements, weight. They will go through things with you, what you want to achieve and things like that. Okay, it'll be more based around fitness, health, and obviously weight and things like that. Okay, I think that'd be a good starting point. Then they'll be able to, write you a program and things like that, and they can work alongside you as well. So they'll be in there with you, encouraging you, pushing you along, okay? And you'll find that the exercise is really going to help lift your mood, okay? and you'll find that you will start losing the weight. You'll get fitter, healthier, and things like that. Okay, your confidence will get better. Okay, I think that'd be really good for you. But the Wellbeing Clinic as well, I would like you to discuss eating disorder and addiction. Okay, as well as mood, anxiety. Okay, good. I think I would recommend you going out for a walk once a day, anytime you like. You know, if you just go around the block, you know, just getting out, fresh air's going to do you good. Vitamin D is going to do you great. You know, I will give you some vitamin D as well, actually. Low vitamin D and iron and things that can contribute to our low mood. Okay, let's give you some vitamin D. I will get you back because I would like a blood test doing and a health check, okay? Okay. Okay, so we have a little bit of a plan. I don't want this rushing in and going too fast with it, okay? Yeah, just one step at a time. You know, we've got a lot to work on. Let's do some medication. Okay. Okay. Right, so I'm going to pass you to the nutritionist, personal training department. They'll both sit down with you, okay, possibly on the same day if I can get that done, okay. There might be a PT that's actually a nutritionist as well. That might be a good step, so hopefully I can get that one for you. Okay. Referral to the Wellbeing Clinic to talk about eating disorders, addiction and anxiety. Okay, I will probably get you to speak to a psychologist as well. I want to start at the Wellbeing Clinic first. Okay. Okay, so a walk once a day, water, no fizzy pop, smaller portions. Okay. Less the junk, okay? So just try to cut it down bit by bit. Talk to your partner, all right? That's an important one. Tell them how you feel. Explain it to them, okay? Talk about things, explain this appointment and the plan, all right? Definitely do that. Definitely talk, don't block it up, okay? You never know, they might want to come and walk with you, okay? They'll be supportive of you. Take the medication, as I've said. I want health check with bloods. Just a general health check, okay? Nothing serious. I would like that within the week, okay? Okay. Remember, no diet, food plan. Okay. Keep active. So even if it's just housework, you know, dancing around the house, or, you know, getting yourself, say, a yoga mat, some resistant bands, you know, you can even get these like pedal exercise bikes, but just for your feet, and you can use them for your arms. So you could just sit here and going along like this, like you're riding a bike and you're actually just sat there. Things like that, you know. Okay, the PT and that will talk to you about gym, exercise, swimming and all those things. Don't worry about that, but there's no pressure on actually joining the gym or anything like that. Have a look at YouTube. You know, there's some great fitness people on there. Even Instagram, there's a lot on there that do it. And I really think you need to try something like the Calm app or other relaxation apps. YouTube have great relaxation channels, meditation. Jason Stevenson is absolutely fantastic. You must check him out. And then I think you want to try ASMR. Have you heard of that before? No. Okay. Google it first. What is ASMR? Okay. Then go onto YouTube. Put ASMR. Okay. Loads of artists come up. They do all sorts of things, from role play, trigger sounds, visual, all sorts of things like that, okay? And it can help give you this nice relaxing sensation, okay? Yeah, you might find that you've experienced that sometime in life as well before. Okay, all sorts of different things like that. Okay, just, you know, take your time, have a look and spend some time for you. Yeah, have a bath, you know, just lie in the bed, watch something you want to watch. You know, grab yourself a massage while things are open. All sorts of different things, okay? Yeah. So that is your prescription. If you can get that for me when you leave here, that'd be good. And start taking that. And just monitor how you go. Okay. Yeah, so that's enough to get us started. Nothing to be ashamed of, okay? It's very common. Yeah. And, you know, after our health check, we can, you know, a bit more of a chat if you wish. But the nutritionist and the PT will be really good. They're good at counselling as well, okay? And they can talk to you about food behaviours and why we do things and all sorts of things like that, okay? Yeah, I know. You're very, very welcome. I know. I appreciate that. And I know you do. Okay. Have any questions for me? Okay, my lovely. All right. Well, I'll let you go. Okay. I'll book an appointment for you. You'll see it on patient access. Okay. Get your medication and I'll sort these referrals out for you. All right, my lovely. You take care now. Bye-bye.